Wanted to do a follow-up to my last video on veg news and fat acceptance because there were lots of comments saying that I misunderstood or misrepresented specifically this section of the article. So I wanted to address those comments. The rest of this is going to be in audio. I just wanted to record the intro and the outro so you could see my hair, which looks very cute today. That's honestly the only reason why. I just wanted to record it because it looks cute. I don't know why. God dang it. What did I do? I don't know. Anyway, let's get to it. So again, mostly referring to that one section and my response to that section. So just as a refresher, I'll go ahead and share my response. In a world where discrimination can range from hurtful, fat people are routinely the butt of jokes in everything from casual conversation to big screen Hollywood movies, to outright dangerous, doctors regularly advise weight loss without further analysis to fat patients while recommending blood work, CAT scans, or physical therapy for patients of smaller size experiencing the same symptoms. Fat people are regularly given the message that they are unworthy. So one of these things is not like the other. Making fun of fat people is awful, but a doctor saying lose some weight, like that's their job. They're supposed to help us get healthy, to stay healthy. If someone walks in to a clinic, to a doctor's office who's 50 pounds overweight, it would be irresponsible for a doctor, for a medical professional, not to say something. Medical professionals need to treat the patient, not their size. Sure, and I'm sure there are cases where doctors are just like, oh, weight loss because it's easier, and that's not the answer. But in many cases, the easiest way to care for someone and the way that makes the most sense is to focus on their weight, on their diet, on exercise. We don't have infinite resources to treat every person. If someone comes in with high blood glucose and they're obese, there's a solid chance their diet, their obesity, their level of activity or lack thereof have something to do with it. It makes no sense to ignore that and focus on less likely causes when 90+% of type 2 cases are caused by diet and lack of exercise. Unless there's another obvious indicator, you start with low-hanging fruit. You start with weight. To do otherwise is to waste time and resources. All right, so let's get to the comments. I think the thing about the doctors at the beginning is being misinterpreted. Some doctors will assume a health complication is purely weight-related and will do no further investigation into cause or treatment of that health issue. Yes, extra weight can cause a lot of health issues, but not every health issue is caused by weight. Reaching a healthy weight won't always be enough to solve the problem. I'm sure you can find some doctors who make all kinds of unwarranted assumptions, but is it most or even many? Because that's what matters. As you just saw in the clip, I did go into more detail with the diabetes example, talking about care and how doctors treat the most likely causes first. Some people got that, but it seems many commented before making it that far. A whole 2 minutes and 54 seconds in, by the way. I know it's a long time. Seriously though, like watch the whole thing before commenting. And also if you're super invested in a topic, which many of those commenting appear to be, maybe watch it twice before commenting. Like I watch videos multiple times before responding. My partner often watches and reviews my stuff too before I ever publish it. Just a thought. Not saying you have to go into that much effort for a comment, but like this stuff is important. Maybe, I don't know, think it through or pay attention to what the person is saying. I don't know. Point is, you'd want to show evidence that this is a bigger problem than the same assumptions targeting fit or active people. No such research appears to exist, which means you're making a wild jump from a handful of anecdotes to condemnation of the medical field for misconduct. You'd also need to demonstrate what kind of harm it causes and what the cost of preventing that harm would be, like doubling or tripling the cost of every office visit with tests that are unnecessary most of the time. What would that cost? What would our healthcare system look like? Reaching a healthy weight won't solve every problem, but it will make many problems better, while at the same time mitigating an arsenal of risk. I agree people should work towards a healthy weight. I'm just saying it's not always enough. I've just heard stories of people who were diagnosed with serious medical issues like cancer way too late to do anything about it because a doctor blew off their early symptoms, like, well, you're fat. In terms of cancer diagnosis specifically, finding it late is an issue for many cancers, particularly rare ones, because they don't always have obvious symptoms and diagnosing them can be hard regardless of weight. And chasing cancer diagnoses isn't good for the healthcare system. Case in point, the Angelina Jolie effect. It's been estimated that in the 2 weeks after her op-ed about BRCA1 testing and getting a double mastectomy, there were 4,500 more BRCA tests than would have normally occurred during that time period, costing $13.5 million. Speaking more generally on these stories, aka anecdotes, people also have stories about herbs curing somebody's cancer doctors leaving scalpels inside people, amputating limbs by accident, being paralyzed but still fully conscious during surgery. It's a large profession. There are going to be crazy, lazy, and incompetent doctors and nurses, and there are going to be honest mistakes from people who are severely overworked. The evidence of harm would be in the big picture, not in a collection of cherry-picked anecdotes. I think this comment is really worth reading. It makes an important point about diagnostics. Anecdotal statements like, my overweight friend with knee pain was told to lose weight, but my thin friend had x-rays done, doesn't inherently mean the overweight patient was treated improperly. As doctors, we try to limit unnecessary testing when possible. Testing can not only be costly, but some tests can be invasive and have side effects like radiation exposure. We're trained to start with the least invasive treatment plans where it makes sense to do so. No two complaints are ever the same, and thus no two treatments are either. In fact, overweight patients with chest pain are more likely to have acute coronary syndrome than healthy weight patients, and would likely warrant a further workup. It's all dependent on the nature of the symptoms and the risk factors of the patient. So I don't know how so many people can make such a blanket statement that doctors treat overweight patients worse by nature of their weight. They may be treated differently, as we all should be, based on risk factors for certain disease. It's important to view the patient holistically in order to tailor the best treatment plan for that particular individual. A little anecdote of my own, or really partner. So partner had some chest pain a while back, and being not obese, he was brushed off and told it was heartburn and not to drink coffee. Spoiler, he doesn't drink coffee, and no, it wasn't heartburn. So based on that story, do doctors have an anti-thin bias? Did partner receive subpar care because he's not fat? So the doctor just didn't care enough about his concerns? The bottom line is statistics and making efficient use of time and resources. It's not wrong when you have a whole country to treat, but it's very frustrating, right? It may seem uncaring and malicious when you don't understand the limitations of our medical system. Doctors never were able to help partner, by the way. We finally got to a cardiologist, and according to partner, the guy came in, left without saying one word, or even giving my partner a chance to ask a question. We sure as shit got the bill though. Finally, one random day, partner overheard me watching Bob and Brad, the two most famous physical therapists on the internet, if you didn't know. And we figured out it was probably this weird condition, costochondritis, I think it's called, issue with the cartilage there. And the movements they were doing in the video, they seemed to help. So yeah, it was just dumb luck. I wasn't even watching the video for that, I think. I was just watching their stuff. Probably something to do with my back. I still had really bad back pain at the time. Point is, a doctor was never going to give my baby daddy the time of day because he's just not at risk for anything. They were right in terms of there being no mortal danger there, but that doesn't mean it wasn't painful and that it wasn't worrying, right? Hearing your soulmate talk about chest pain constantly, not fucking cool. Now let's move away from anecdotes for a second and talk about actual evidence, which actually points in the opposite direction to what the radical fat acceptance activists claim. It points to thin people being treated worse based on the U-shaped mortality curve, despite the evidence of mortality from disease. The theory is that, at least in part, heavier people are being given more care because they're at greater risk. Obesity outpaces this advantage at the higher extremes, but being moderately overweight means that doctors pay more attention to warning signs of your most likely killers, and that translates to lower mortality than for your skinnier peers who will be ignored because of their low risk. To share another personal anecdote, I myself could certainly complain about the care I get as a normal BMI person. When I go to virtually any appointment, including prenatal appointments, they are comically short. If I didn't know better, I would think they just did not give a shit, wanted to move on to the next patient, which is partially true, I'm sure. But mostly it's because my weight's good, my blood pressure, heart rate are fine, there's no worrying symptoms to report, right? Why waste money on a longer visit or, God forbid, testing when most likely there's nothing wrong? Even when I went to get checked a few years ago for fatigue, the doctor ran, I think, a couple tests, thyroid, vitamin D, but everything was fine. And she just said that some people just need more sleep, and then sent me on my way. I could totally complain about her not taking me seriously because I'm not overweight. I mean, there are about a million possible causes for fatigue, right? She certainly could have run more tests or sent me to a sleep center or something. Or I could see it her way, what I imagine is her way. Of course you need a nap every day. Of course you feel tired. You work, you have a little kid, and you still manage to work out almost every single day. Yeah, most working parents are sleep deprived. You're probably tired. Again, just one anecdote. We don't make prescriptions based on them. And even with that study, it's still a matter of interpretation. But a lot more than radical fat acceptance activists are bringing to the table. Throughout the comments, there are people bringing up supposed studies, claiming that a simple Google search will tell me all I need to know. Okay, Are these studies based on credible science that makes the kind of claims that many are making, right, regarding medical malpractice? Or are we talking about like irrelevant implicit association tests, which don't say anything about actual treatment being administered, or a survey of a selection of overweight people saying they're worried about going to the doctors because of fat bias, which again says nothing about the actual treatment. If you do have something, please cite your source. Don't expect me to be able to find what you're talking about. I've looked and all I can find is anti-scientific garbage, issues unrelated to actual diagnostic performance, not evidence of any actual systemic issue or misapplication of obesity in diagnostics. Like, look at this. Holy balls, this is not science. That's what I'm gonna assume you're talking about. If you don't tell me, that's what I assume it is. And before you give me a list of sources copy-pasted from some blog, please remember my raw book and all of its sources. It matters what the sources actually say, right? So please don't refer me to something you didn't actually read or don't know how to read. Smoking cigarettes on average will reduce your life expectancy by 10 years, more than being fat and almost as much as being obese. Yet cigarette smokers aren't told by doctors that they can't get treatment for other conditions until they lose weight. How can you possibly know that? In fact, there were a couple comments from smokers claiming just that. Doctors seeing their smoking and telling them to stop and like blaming complaints on the smoking rather than running more tests. That's the thing about anecdotes. They go both ways. This commenter explained it really well, I thought, with an analogy to smokers. It's like being surprised that smokers get less tests for breathing difficulty than non-smokers. The physician is going to assume, and probably correctly, that smoking is the causative factor for their breathing problems. Are they going to be wrong a fraction of the time? Of course, but that is how the medical field operates to avoid burdening the system. I really don't know what possesses people to just make up arguments. Like, doctors don't do this to smokers when they don't have experience with it and haven't bothered to look into it to see if that's actually true. I don't know, if you feel the need to do that to make like this never happens type arguments about things that very likely happen, maybe you're way too close to the issue and honestly should just stop commenting on it. Studies show that suggesting someone lose weight doesn't lead to weight loss. Being told to lose weight all the time is more likely to lead to depression, self-esteem issues, eating disorders, and yo-yo dieting. I mean, most things don't lead to weight loss, right? It's a hard problem. It does happen sometimes. I've talked about before the database that tracks people who have lost substantial weight and kept it off for years. And while the default seems to be steady weight gain, yo-yo dieting is not the great evil that people portray it to be. I talked about that in, I think, this video. If you want a more nuanced take on weight discussion, you have to look more closely at messaging. Similarly, there are many ways to encourage people to go vegan, right? Some are much more effective than others. We need better research to understand what those are. Feeling shame and stress about their bodies doesn't translate to weight loss most of the time though, but it does some of the time, right? The empirical question is how effective shame is versus the harms. Does shame shed or add net pounds to the population? Unfortunately, studies do a pretty poor job of qualifying shame or quantifying the effects. I personally don't advocate for intentional shaming, but I'm not going to say it never works ever. I don't personally think it's good practice, since trying to shame people means being mean. And when something seems mean, we usually want to err on the side of being nice, unless there's evidence that meanness works, right? But the opposite of that isn't avoiding any and all messaging that could possibly lead to somebody ever feeling shame. You are assuming that all fat or obese people are continuing to gain weight. Say someone gets depressed, stops exercising or eating well, and gains 50 pounds. If they then get out of their depression and go back to eating and exercising regularly, they will just maintain that new weight. Unless they eat in a caloric deficit, they won't lose those 50 pounds, even if they are eating well and moving daily. So you said that you can look at someone and know what their lifestyle is, but that's not necessarily true. First, that is not what I said. I specifically said you can't know for sure, but you can have a pretty good idea. The implication of the first sentence, like, yeah, sure, you can't totally know what someone is doing based on their size, but you can probably get a pretty good idea. It's not like we don't have any idea what sort of lifestyle leads to obesity. If you're overweight, you're consuming more calories than you burn, and very, very likely those calories are not coming from broccoli and beans. Second, maintaining that new weight is not at all a given. Set point is malleable. It seems to take a long time to change, but there is no weight that your body just like has to be at. I talk about this more in my intuitive eating video. And one of the issues with intuitive eating is this idea that set point is just like, that's your number and it stays that way forever. It's just your God-given weight. No. Point is, you don't know what an obese person is eating every day, but you do know on aggregate what the food to exercise ratio looks like, because they're not breaking the laws of thermodynamics. And a doctor has even more insight, right? Because the medical chart records weight over time. A doctor knows if you're gaining or losing weight, assuming you've had regular appointments. Maybe it's time to rethink how we approach health, weight, and discussions around weight loss to actually help people have a good relationship with their bodies, their doctors, and with society at large. I think that more people will be able to have healthy weights if we stop demonizing fat people. Just to be clear, I don't think this person is suggesting that, but just to be clear, I've never advocated demonizing fat people. Quite the contrary. I think much of our focus should be on gastric bypass and other ways to make it easier to lose weight, possibly drugs in the future. Also, our food environment and the junk food lobby. It's why I've personally stopped buying mainstream junk food from big brands. As much as I love those stupid Doritos, I really don't want any part of my purchase funding their lobbying against regulation that may help fight obesity. Too often, doctors will prescribe weight loss rather than actually investigating to figure out if weight is the problem. The problem isn't doctors prescribing weight loss, it's when doctors prescribe weight loss without looking for confounding factors and without listening to their patients' concerns. The tests may be redundant, but how would the doctor know without running them? That's their job. It's their job not to run unnecessary tests, to not waste the patient's money with the copay, and also to not have the insurance companies scoff and deny coverage. Doctors are still beholden to the insurance companies, which are beholden to the bottom line of cold, hard evidence to pursue preventative care when it saves money long term. And it's not like the insurance companies are just evil. I know that's the perception people like to have, but they have to stay solvent so they can provide a service, and their margins aren't very big. For many conditions, weight is so overwhelmingly likely to be the problem that it would be malpractice to order a bunch of unnecessary tests. And as doctors are told, when you hear hooves, you think horses, not zebras. Looking for rare conditions everywhere is bad medical practice. It's also important to remember that from the doctor's point of view, which is the correct point of view, losing weight is very, very safe. It has very few, if any, downsides for the average person, unlike prescribing medications or even running tests. And it also has other benefits, right? It's not just the specific symptoms you went in for, it's probably going to help in other areas of your life as well, even if it doesn't help for those symptoms. So you can understand why a doctor might be more eager to suggest weight loss, even though there could be another cause. I went to the doctor for stomach problems and they ran urine and blood tests and all of my results were fine. Because of that, we know it's likely a digestive related issue, not a hormonal one, and I can go see a gastrointestinal doctor to get an endoscopy. Their job is to run tests and figure out what's wrong with you, not just look at you and assume weight is your only problem. They can tell you to lose weight, but they should verify that's the only source of the problem. Perhaps the tests are giving you some peace of mind, perhaps they're unnecessary. It could even be a wild goose chase because, vague symptoms like that are often really hard to nail down. In any event, losing weight is a form of test, right? If it doesn't solve a usually weight-related problem, then it would be time for more tests. Which is why when a physically fit person presents with unambiguous symptoms that seem to be a weight-related condition, doctors get confused and they do need to order some tests. This is a last resort, right? Tests are expensive. They're resource intensive. You misunderstood the bit about the doctor. She's referring to doctors refusing to run tests on fat people for non-weight related concerns, as well as dismissing any and all concerns as solvable through weight loss. Really? Dismissing any and all concerns as solvable through weight? So if a patient comes in with a broken arm, the doctor's not going to set and plaster it. They're just going to say, oh, lose weight? Seriously? I want to address this comment because it makes specific medical claims that I actually have some personal experience with, which makes it even funnier. And of course, starting with I might have to unsubscribe. It's just always funny. You used diabetes as a straw man to argue against. Of course, a doctor is going to suggest weight loss to an overweight patient complaining of diabetes-like symptoms. Where this example falls apart, though, is the doctor isn't going to prescribe weight loss and then send the patient on their way. It takes time to lose that significant of an amount of weight. These patients could die in the interim. How is that a straw man? Obviously, a doctor is going to want to follow up and keep testing in case it becomes severe enough to require insulin treatment. Short of that, the main course of treatment would be diet and exercise with the goal of weight loss and preventing the metabolic condition from worsening. This is a scenario where the development of type 2 diabetes is strongly linked to obesity, as you said, but it is not a scenario where a doctor would refuse tests and instead dismissively prescribe weight loss, as was argued within the article. You're arguing something different entirely. So then she tries to give an example of what the article is talking about. For example, imagine a fat person presenting with an irregular period that was so heavy and unpredictable that it was immensely negatively impacting the person's life. The article here is arguing against doctors saying, well, being fat causes hormone imbalances, and those hormone imbalances are what's causing your symptoms, so in order to alleviate those symptoms, you have to lose lose weight and not running any further diagnostic tests. Why is this a problem? Yes, these symptoms could be due to being overweight, but they could also be due to hypothyroidism or PCOS, among other things, I'm sure. Both hypothyroidism and PCOS are associated with weight gain and obesity, and it looks like obesity may even increase the risk for hypothyroidism. Regardless, a doctor might test for those if a patient showed up with obesity and irregular periods. I imagine they would test for polyps before that, like they did for me, and then prescribe birth control, but maybe not if, again, the patient is significantly overweight. Although telling an obese person to lose weight does make sense in this context, given that obesity increases the risk for irregular heavy periods. I'm sure protocol is not just to tell them to lose weight, or maybe it is. I don't know. I mean, again, we have to know statistics before deciding care is inadequate or incompetent. What is the likelihood of this person's condition being caused by their weight? What is the likelihood of it being caused by hypothyroidism or PCOS or something else? Because if the most likely cause is obesity, it does not make sense to start with testing the thyroid or an ultrasound for polyps or whatever else. The reason I specifically chose type 2 diabetes is because we know those stats. You just pulled this example out of your asshole as a gotcha, but it's not a gotcha because you present no data. Just because the patient's problem wasn't caused by their weight does not mean the protocol was inadequate. And again, I already acknowledge cases much worse than this exist, right? Doctors just not giving a shit and saying lose weight. It doesn't change the fact that often the correct diagnosis is lose weight. So now you have a person whose suffering has been prolonged by months or even years because the doctor assumed a causal link between their symptoms and obesity, but in the wrong direction. Not necessarily. Obesity causes or exacerbates those conditions. Weight loss would likely help significantly. Also, it's really interesting, the implication in a lot of these comments that finding relief through weight loss for like any illness takes months and even years, which is not necessarily true and a really crappy thing to tell people. Like, many find relief rather quickly after losing only about 10% of their weight, which is great. Like, that's something that people should know, right? It's not like you suffer until the moment you reach normal BMI and then poof, all better. It's like, no, you don't even have to reach normal BMI. Going from like, what is it, obesity 3? I forgot exactly what they call the terms now, but going from like 3 to 1 is a huge change. Even though you're still obese, you will probably notice improvements in your health. Anyway, now for my favorite part. These tests, meanwhile, would have most likely been given had the person presenting with those symptoms been within the average range of size. Really? Because I'm within average range of size and I was not tested for PCOS or hypothyroidism despite having 2 periods a month. Instead, I received an ultrasound for polyps and was then put on birth control. So yeah, maybe refrain from creating examples based on conditions you know little about. Just a thought. And funnily enough, this was the one and only time a physician ever mentioned anything about my weight other than just like, oh, you look good. You have 2 kids. I can't believe it. You know, I get some of that. Feels good. I'm not gonna lie. But yeah, she asked me if I did any cardio, which I didn't understand. I said, no, not really. I do mostly strength training. That's what I was doing at the time. And then suggested that I should like do some. I should do cardio a couple days a week. And I kind of just sat there for a moment because I didn't understand what she was saying. And then it hit me like, holy shit, she thinks I need to lose weight. So I asked, and she said that, you know, it could help with my symptoms to lose a little. And yeah, it was weird. I'm not gonna lie. It sucked. It did not feel good. Even though like I was not fat, I knew I wasn't. A doctor saying like, you could stand to lose a little. It sucked ass. But I think it suggests, you know, what a large role weight plays in this, in irregular and heavy periods. I mean, you know, one thing I didn't have when I was 108 pounds, heavy irregular periods. I mean, I didn't have any period, but whatever. Point is, you're just wrong about this. Commenter, you're not following evidence-based diagnostics. I understand why you feel this way, but you need to understand consequence and parsimony. We can't expend infinite resources on every person. Contrary to what many people believe, human beings have a price tag in terms of what they provide to society and what it's worth to spend on them. And it's not good for anybody if we run healthcare in a way that bankrupts itself. We can be inordinately compassionate and spend millions on rare diseases, so long as they're rare, right? Like cancer in children. But as soon as you start talking about common diseases that are caused by obesity and can be treated without medical intervention by diet and exercise, It doesn't make sense, and it's not a viable way to run a healthcare system. The obesity epidemic is already responsible for immense healthcare spending in the Western world. Again, it takes time to lose weight. Telling someone to lose weight before you'll help them is immeasurably cruel when there may well be medications and other therapies which exist and could improve their quality of life to a point where they would even have the mental and physical energy to make the daily choices required to actually lose weight. You don't understand limitations and resources or our overburdened medical system. You are incapable of understanding or accepting triage, which we're basically running at a national scale due to budget constraints. And you can't fathom the calculus that says, this is where I get into trouble. Let's let this person die. It's too expensive to save them. We need the money to save 10 other people. Triage is not cruel, not immeasurably so, not at all. It's the right thing to do. What is cruel is letting the system crash under the burden of overtreatment in the name of justice. I'm sorry, but we can't devote 200% of the medical resources the entire country needs to less than half of the population because they had whatever combination of unfortunate environment, genetics to avoid the situation. Saying it's wasteful to run these tests when the person could, in theory, just power through another few months or years of suffering to get rid of their symptoms via weight loss makes it seem like only thin people are morally worthy of treatment and that fat people must suffer for their choices. Okay, this is the thing that's really going to get me in trouble. Thin people earn more money because they're healthier, they pay more taxes, and they're cheaper to care for medically. They're literally worth more in terms of value to the system, and they keep the system going. Without them to carry the rest, a system filled with unhealthy people taking unnecessary tests all the time, and with less money to pay in, the system would crash and everybody would suffer far more. That's why the Affordable Care Act came with the individual mandates. Anyway, it's clear there's just a huge disconnect here that is impossible to bridge between the deontological view of rights and what people are worth or deserve, and the consequentialist view of pragmatically trying to help the most people with the resources we actually have. Unless I can convince you to radically change your view of the world and morality, we will never agree. And I think that's the case for a lot of disagreement here. Some people are trying to be consequentialist too, and I think suffering a lot of cognitive dissonance. So they have to change reality to make it so there's like a conspiracy against fatness and fatness actually is healthy. But for most of the comments here, it seems like people at least recognize the fact of how bad obesity is for you. And there's just this fundamental divide of people not understanding justice and morality. I don't know how to fix that. I do not have the know-how, the skills, the ability, any of that to fix that. If you're only willing to listen to views through a social justice lens and you aren't interested in hearing from a consequentialist, then yeah, you're probably going to want to smash that unsubscribe button. Like, I'm a consequentialist. I won't stop caring about consequences. Every time you think that's cruel, well, remember that I see your position as cruel in terms of its consequences, right? Destabilizing the systems we rely on, failing to help the largest number of people with the resources we have in reality. It is cruel to only help the most marginalized at the expense of everybody else. It is cruel to be willing to harm or deny adequate funding for care to 1 million people to help one, even if those 1 million people are otherwise healthy and able-bodied, and that one is generally unhealthy and disabled. A person is a person, and everybody counts once. Nobody is morally more important for the sake of privilege or marginalization. Thank you so much for watching. I hope you enjoyed this. Hopefully, oh wait, I already did an outro, didn't I? Thank you so much for watching, everybody. I hope you enjoyed this. Hopefully this clarified some things. Even if you don't agree with me, that's perfectly fine, but hopefully maybe you understand my position a little bit more. I don't know, but yeah, thanks again. If you liked the video, like it. If you want to be notified when I upload, you can click the bell. If you want to subscribe, that's cool. If you want to support the channel, you can at patreon.com/unnaturalvegan. You can also support the channel by buying some shirts, some goofy ass shirts that I have. I also have an Amazon store page with some stuff on there. I like books and some food, a little bit of food, protein stuff. Of course, it's like, what do I have? Protein bars, protein powder, and protein puffs. I believe that's all I have in terms of food. So that's fitting, right? Yeah. Anyway, thanks again. New video soon.